I'm Dr. Linda Gromko, and this is Transgender Medicine Made Simple. Today we're looking at the question, what do you want to see happen in your gender transition? If you won the lottery tomorrow and you didn't have to consider friends, family, work, all of that kind of thing, what would you like to see happen? Now, of course, this doesn't really reflect real life, but what would you want to see happen? And be as specific as you can be. You are more likely to get what you want, or as close to it as would be possible if you know what it is that you want. I have seen little kids grow up in the gender of their identity by using puberty blockers and cross hormones, and they've done great. I have heard an extremely high-risk teenager say, I would be dead by now without testosterone, and I'm pretty sure he was right. I watched as a college woman transformed into a lumberjack with a full beard and a twinkle in the eye in only a year's time, and they were elated. I dabbed the tears from the cheeks of a sophisticated professional woman who had emerged from a craggy, bearded face with the benefit of laser hair removal and neurotoxins and dermal filler, that is to say, no surgery. And she told me, I never believed that this was even remotely possible. I recall a trans woman who took every tenuous step, from hormones and laser facial hair removal to genital hair removal and finally to gender-affirming genital surgery, all while knowing that her wife was planning to leave her. She had to transition to be herself and follow her truth. But imagine her joy when her wife decided not to leave. Now, of course, it doesn't always happen this way, but for her, that was her story. I know an 18-year-old who orchestrated his own testosterone treatment and top surgery by the time he was 16, and by the time he was 18, he had already had his phalloplasty surgery. This was amazing. I remember one of the first trans patients that I assisted with hormones is now claiming her place as a trans community matriarch. 2 of her children embrace her, but 2 have cast her aside, but she lives her life with great purpose and great dignity. I have witnessed these stories daily, and while there is great pain and sadness in the trans community, I have witnessed many more victories than I've witnessed sadness. Know what it is that you want as specifically as you can. Talk to people that you trust and decide what is right for you and for your life. And of course, don't do anything that's permanent, for example, surgery, if you are not certain of your goals and how to get there. I hope this information has been helpful for you today. If so, please like this video and do subscribe to my channel, Transgender Medicine Made Simple. Thank you for watching, and I'll see you in the next video.